The World Health Assembly kicks off in Geneva next Monday, and even though Taiwan hasn't been invited to attend, Health and Welfare Minister Chen Shih-chung is mobilizing a WHA Action Team to speak out for the nation.
Disappointed that the WHO's actions betray its own constitution and put politics above human rights, Chen said they would hold a Geneva press conference and are considering a formal letter of objection over Taiwan's exclusion.
Even though it looks like Taiwan will be excluded from the WHA this year, Health and Welfare Minister Chen Shih-chung is sending a delegation to Geneva consisting of former CDC Director-General Kuo Hsu-sung, former Ambassador-at-Large Wu Yung-tung, and other senior health ministry officials. The delegation is slated to depart later tonight.
We
must express our discontent and regret. From the perspective of health and disease prevention, we will express our most solemn opposition. I have already said that Taiwan needs the WHO, and the WHO needs us too.
The so-called WHA Action Team is slated to hold an international press conference to express Taiwan's opposition to the snub. Chen suggested he might submit an official letter of protest to the WHO and said he would take the opportunity to conduct bilateral and multilateral meetings with countries that support Taiwan's inclusion, including the United States. But when asked if members of the WHA Action Team would be allowed to attend the summit as visitors, Chen wasn't as hopeful.
Of course, I don't have much hope, but on the other hand, the Ministry of Foreign Affairs and Taiwan's de facto embassy in Geneva are still working hard to get us in the assembly. We'll apply for admission, but I know the chance is slim.
Upset by the WHA's decision to betray its own constitution and let politics override human rights, the Health and Welfare Ministry is using concrete action to make a statement. Representatives from the Taiwan Medical Association and some non-governmental groups are also going to Geneva to advocate for Taiwan's participation in global health and medicine.